Well, this is an example of a child who had a medical problem that then became a behavioral problem for the whole family, really. So it was I think he was 4 months old at the time of diagnosis, and he was found to have pretty significant congenital heart disease that was impairing his growth. And he sent down to Children's and had a corrective surgical procedure, but then went on to develop some complications from his congenital heart disease. And so the family was spending a lot of time suddenly taking care of this young boy, making trips down to the cities, and really came to view him increasingly as medically fragile. And it initially started, Mom came in and had some significant concerns about his development. He wasn't doing the gross motor things that she had expected, and wasn't maybe doing some of the communication things that she had expected. And so I think initially we talked about maybe just having Help Me Grow come out and evaluate him and maybe help with some of this. But then as we had ongoing discussions over the next couple of months, she talked a lot about how he seemed really scared and would cling to her a lot. And then eventually his older sister started having similar problems as well. And I think at that point we just sort of had a discussion about, what's the trajectory of this and how are you feeling about it? And they felt really stuck and didn't know what to do next. And so we talked a lot about how these would be pretty normal changes that would happen in any family who was going through what they were going through, and maybe they just needed some help thinking outside of the box a little bit about how to normalize some of those things in their family and cope and adjust. And so I referred him over to Casey.
And I saw the whole family, so I saw the very young boy and his older sister and Mom and Dad together. And I was really talking with the parents about trying to assess the level of stress that existed in all of the relationships, in the marital relationship, the parental relationship, and the sibling relationships had all been affected by how terrifying this medical crisis was for this family. And the kids were doing a fairly good job about finding creative ways of getting Mom and Dad's attention, but not necessarily in ways that we wanted to kind of continue and promote. And so it was trying to, with the mother and father, really try to help them get on the same page about some of their parenting expectations. And I think that they had gotten, like I think many families do in these situations, is a bit too permissive with the kids, and they were really afraid that if this boy cried, that it could really create a terrible kind of health problem. And I had to consult, because I'm on the phone with Heather saying, okay, now this is what I normally would do with a family, and let's modify this, and what can I really do, and how much can we push or stress this little guy in terms of some of his limits, or trying to really help him learn a bit more of how to separate from Mom, and how to create some opportunity for Dad to be able to come in and have a relationship with him, as well as Dad having a relationship with their daughter. Because I think that Mom was feeling pretty fried, that she was doing a lot, but she was afraid to really begin doing what we would say is some of that normal separating from both of the kids, which, as we all know, that puts stress on marriages. So that was, I think, a really lovely example about a family intervention that was really helping the family understand what his medical needs were, what were age-appropriate social emotional expectations for him and for the daughter, and to begin turning the distress in the family around so that there was more joy, there was more playfulness, and reduce some of the distress that they had.